Most people assume that when a surgeon recommends an operation, it must be the right decision. The doctor has the experience. The hospital has the technology. Everything is prepared. All that's left is to agree. That's how it usually goes. I used to think the same way, until I started paying closer attention to what happens after. Not during the procedure. After. Patients who walked in expecting relief and came out facing something completely different. A man who went in for routine back surgery and never walked the same again. A woman who survived a major heart procedure but spent months struggling with complications she was never prepared for. That's when I realized something most people are never told clearly enough. As the body ages, it doesn't just fight disease differently. It fights the stress of treatment differently. And sometimes, the greatest challenge isn't the condition itself. It's what the body has to go through to fix it. I've spent over 2 decades working alongside surgical teams, observing how different patients respond not just to procedures, but to recovery. And today, I want to walk you through something that can completely change how you think about surgery after 60. Because the real question isn't just whether a procedure can be done, it's whether the body can recover from it, and those are not the same thing. Let me give you a simple way to think about it. If you take a brand new system and a system that's been running for decades and push both to their limits, you already know the outcome won't be the same. And yet, for a long time, medicine treated them as if they were. Same approach, same expectations, same recovery timelines. That's starting to change, but not fast enough. Here's what actually happens during major surgery in an older body. The heart is placed under greater strain. The lungs take longer to clear anesthesia. The kidneys slow down when processing medications. And the brain, this is where many people are caught off guard. After major procedures, it's not uncommon for older patients to experience confusion, memory issues, or difficulty concentrating. Sometimes for days, sometimes for weeks, and occasionally much longer. Now let me be clear about something. Age alone is not the deciding factor. I've seen people in their 80s recover faster than others in their 50s. The real factor is something called frailty. It's the body's ability to handle stress, to adapt, to recover. And when that reserve is low, the margin for error becomes very small. So the real question isn't just, will I survive the surgery? It's, how will I come out on the other side? Because survival and recovery are 2 very different outcomes. And that distinction matters more than most people realize. So today, I'm going to show you 5 types of surgeries that carry hidden risks for people over 60. And more importantly, what you should understand before making that decision. Let's start with one of the most trusted procedures in modern medicine, heart surgery. For the right patient, it can be life-saving. There's no question about that. But here's what many people don't fully understand. When you operate on the heart, you're not just affecting one organ. You're placing stress on the entire body. In many major heart procedures, the heart is temporarily stopped. A machine takes over circulation, doing the work of both the heart and the lungs. For someone younger and physically strong, the body can often tolerate that level of stress. But in older adults, especially those with existing conditions, the situation becomes very different because the impact doesn't stay contained. The kidneys may struggle to recover after changes in blood flow and medication processing. The lungs can take longer to regain normal function. And the brain, this is where families often notice the biggest difference. I remember a patient in his mid-70s. The surgery itself went well. Technically, everything was successful. But days later, he was still disoriented. He didn't recognize where he was. He struggled to follow conversations. His family kept asking the same question. Is this normal? Sometimes it is. But what matters is that many people are never prepared for it. They expect the surgery to fix the problem. They don't expect the recovery to become a new challenge. And in older patients with reduced physical reserve, complications become significantly more likely. We're talking about stroke, kidney issues, prolonged time on ventilators, extended hospital stays, and recovery periods that stretch far longer than expected. Now, I want to be very clear. This doesn't mean heart surgery should be avoided. It means the decision needs to be made with a full understanding of the reality. Because today, in many cases, there are alternatives, less invasive procedures, techniques that don't require opening the chest, approaches that reduce stress on the body while still addressing the underlying issue. But here's the problem. Most patients don't know to ask. They hear surgery and assume it's the only path forward. So here's the question that matters. Is there a less invasive option for someone in my condition? That single question can completely change the conversation. And sometimes, it can lead to a path that is not only safer, but far easier to recover from. Because when it comes to decisions like this, the goal is not just to fix the problem, it's to protect everything else that matters. And that brings us to the next situation, one that affects millions of people, but is often misunderstood. Now let's talk about something almost everyone over 60 experiences at some point. Back pain. It starts quietly. A little stiffness in the morning, a dull ache after walking, a sharp pain that comes and goes. And over time, it becomes part of daily life. So when that pain gets worse, people naturally look for a solution. And more often than ever, that solution being offered is surgery. Spinal fusion, multi-level decompression, hardware placed along the spine to stabilize it. Now I want to be very clear. There are situations where spinal surgery is absolutely necessary. If there is severe nerve compression, loss of function, or risk of paralysis, surgery can be life-changing. But that's not what most people are dealing with. Most older adults are dealing with long-term degenerative back pain. And this is where the conversation changes, because complex spinal surgery carries real risks: blood clots, infections, hardware failure, and something most patients are never warned about. When one section of the spine is stabilized, the surrounding segments are forced to take on more stress. Over time, those areas begin to wear down faster. So you fix one problem and slowly create another. I once spoke with a patient in his early 70s who had undergone spinal fusion. At first, the pain improved, but within a year, new pain developed above the surgical site. Different location, same problem. And eventually, he was offered another procedure. That cycle happens more often than people think. But here's the part that surprises most patients. In many cases, long-term outcomes for chronic back pain are not significantly better with surgery compared to non-surgical treatment. Physical therapy, strength training, targeted injections, consistent structured movement. These approaches may take more time, but they often come with far less risk. And for many patients, they lead to similar levels of pain relief over time. The difference is what the body has to go through to get there. So before accepting surgery as the only solution, there's one question worth asking. What would a structured non-surgical plan look like for me over the next 6 months? Because sometimes, the best decision is not the most aggressive one. It's the one that respects what your body can realistically handle. And that brings us to the next situation, one where emotions run high, and decisions are often made under pressure. Now we come to one of the most emotionally charged decisions a person can face: cancer. The moment that word is spoken, everything changes. The instinct is immediate. Act fast. Remove it. Do whatever it takes. And that reaction is completely understandable. But this is also where some of the most important conversations are often rushed. Because when urgency takes over, clarity sometimes disappears. And in older patients, especially those with other health conditions, that can make a critical difference. Let me explain. Some cancer surgeries are among the most demanding procedures in medicine. They can last many hours. They involve multiple organs. They place intense stress on the body. In younger, healthier patients, the body can often absorb that stress. But in older adults with reduced reserve, the situation changes. The surgery may go exactly as planned. The tumor is removed. Everything appears successful. But then the recovery begins. And that's where the real challenge often starts. I remember a patient in his late 70s. The operation was technically perfect. But within weeks, complications began to develop. Weakness, loss of appetite, infections. His body simply couldn't regain stability. And what started as a fight against cancer became a struggle to recover from the treatment itself. This is one of the hardest realities to talk about, because it goes against what most people believe, that more aggressive treatment always leads to better outcomes. But that's not always true, especially later in life, because the goal is not just to remove a disease. The goal is to preserve meaningful life. And sometimes that requires stepping back and asking a different question. Not how fast can we act, but what approach gives me the best overall outcome based on my condition? There are situations where less aggressive options can provide similar results. Targeted therapies, radiation, careful monitoring, approaches that match the body's ability to respond. But many patients never fully explore these options, because the moment surgery is recommended, it feels like the only responsible choice. So here's the question that can open a completely different path. If we don't operate immediately, what other treatment strategies are available for someone like me? That question doesn't delay care. It expands your understanding, and sometimes it leads to decisions that protect not just time, but the quality of that time. And that brings us to the next situation, one that seems routine on the surface, but becomes far more complex depending on when it's done. Now let's talk about something many people consider routine: joint replacement, hip surgery, knee surgery, procedures that have helped millions of people regain mobility and independence. And in the right situation, they can be life-changing. But here's what doesn't get discussed enough. The success of these surgeries in older adults often depends less on the procedure itself and more on the condition of the body going into it. I once met a patient in his mid-70s preparing for a knee replacement. He was told it was a standard procedure, low risk, very common, and in many cases that's true. But what wasn't fully addressed were his underlying conditions: high blood pressure, early-stage diabetes, reduced physical activity, nothing extreme on their own. But together, they changed how his body would respond to stress. After surgery, recovery was much slower than expected. Mobility took longer to return. Fatigue lingered. Complications had to be managed carefully. And what should have been a straightforward process became a much longer journey because the body wasn't fully prepared. This is where timing becomes critical. Not just scheduling the surgery when the pain becomes unbearable, but when the body is actually ready to recover. Because in older adults, risks increase when multiple conditions are present. Blood clots become more likely, infections become harder to fight, and prolonged immobility can lead to additional complications. But here's the part that changes outcomes: preparation, improving cardiovascular health, stabilizing blood sugar, building strength before surgery. Even small improvements can significantly reduce risk. Some programs now focus on this exact idea, preparing the body before the procedure even happens. And patients who go through that process often recover faster, with fewer complications. So here's the question that matters: what can I do in the next few weeks to improve my chances of a better recovery? Because surgery is only one moment in time. Recovery is everything that follows. Now there's one more situation we need to talk about, because unlike everything we've discussed so far, this one doesn't give you time to prepare. Emergency surgery. This is when decisions are made quickly, sometimes within minutes. And in older adults, these situations carry some of the highest risks, not because the procedures are done incorrectly, but because the body is suddenly under extreme stress. Every system is affected at once: the heart, the lungs, the kidneys, and in a body with limited reserve, that can become overwhelming. I've seen families standing in hospital hallways late at night, trying to make decisions they were never prepared for. Yes or no, proceed or don't. And without prior conversations, those moments are incredibly difficult. So there are two things that can make a real difference. First, don't ignore early warning signs: persistent pain, changes in digestion, unusual symptoms. Catching problems early often prevents emergencies later. Second, have the conversation before it becomes urgent. What matters most to you? What kind of outcome would you want? Because when those decisions have to be made quickly, clarity beforehand changes everything. And now that we've covered all 5 situations, there's one final piece that matters more than anything else. After everything we've talked about, there's one idea I want to leave you with. A recommendation is not a decision. It's the beginning of one. No matter how experienced the doctor is, no matter how advanced the procedure is, you still have a role in what happens next. And that role is more important than most people realize, because you are the one who lives with the outcome, not for a day, not for a week, but for the rest of your life. So before any major surgery, especially after 60, there are a few questions worth asking. What happens if I wait? Is there a less invasive option? What will recovery actually look like for me? Not for the average patient, but for me. Because the difference between understanding and assuming can completely change the result. I remember a patient who came in after being told by several doctors that surgery was the only option. He wasn't afraid of the procedure. He was afraid of losing the life he recognized. So he asked more questions. He took time to understand his situation fully. And when we looked at everything together, it became clear there was another path. Not easier, not faster, but better suited to his condition. He chose that path. And years later, he was still living independently, still active, still himself. That doesn't mean surgery is wrong. It means the right decision depends on the person. And that decision should never be rushed. Because this isn't just about fixing a problem. It's about protecting everything that makes your life yours. So take the time, ask the questions, understand the options, and don't be afraid to pause before saying yes. Because the surgeon performs the operation, but you carry the result, and that choice should always belong to you. If this helped you think more clearly, share it with someone who might need it. Sometimes one conversation is enough to change everything. Take care of yourself, stay informed, and never hesitate to ask questions about your own health, because the best decisions are the ones made with clarity. And one last thing, everything shared here is general information based on experience and research. Every situation is different, so before making any decision, always speak with your own doctor or specialist who understands your full medical history. That conversation is where the right decisions begin.